Hello, my name is Jake Hillard and I'm an occupational therapy student at St. Andrews University. Today, I'm going to take you through a couple of hot sheets that I created over some articles that I critiqued to hopefully give you better information and evidence to improve your practice. The first article that I would like to discuss is the pediatric article. The objective of this article was to identify a variety of different interventions through a variety of different diagnoses in children. If you want to look more in depth through the inclusion and exclusion criteria, you can see that on your hot sheet in front of you. This was a systematic review, and it is to act as a one-stop access to give recommendations based on the strength of evidence. The way that they did this is they used the evidence alert traffic light system. This means that they categorize the interventions in three different formats, which is green, yellow, and red. Green means that it's a go and that there's high quality evidence. And yellow means measure, meaning that there's probably not enough evidence or there's insufficient evidence and more research is needed in order to categorize that in either green or red. And then red means stop, meaning that there's high quality evidence in either it being harmful or ineffective. The results through this is through the 52 interventions, 40 of them were noted as a green light. A couple of them to note is mental health with autism spectrum disorder, pain management, parent education on feeding, and goal-directed interventions. It is also important to note that there was 22 different diagnoses that were identified through the 12 articles that were chosen for this systematic review. A couple things that I think I took away from this personally, the clinical bottom line would be that activity-based, a top-down approach for your interventions show a bigger gain. And if you want to see more of the interventions other than the 4 examples that I gave you, you can take the reference on the top right of your hot sheet and go look at them in the results section. And they do go in depth as to which interventions go with which diagnoses. So that's really nice about this article itself. Another thing is that parent partnership with an OT is shown as effective and worthwhile. So things that you can take away from this article yourself to improve your practice is if you're doing a home exercise program, you want to try to stay with that top-down approach for the interventions that you're providing for the families. It is also important to note that as you're going through interventions yourself, that you want to make sure that you are holistic and that you are providing interventions that have some sort of goal and you're not just trying to fix the root of the problem, but you're also looking at the performance patterns and other client factors that might be affecting the reason why they cannot participate in their occupations. The second article that I would like to talk about is about constraint-induced movement therapy, or CIMT. This is on the back of your hot sheet. This is in an inpatient setting, and the objective of this article is to find the effectiveness of CIMT versus a motor relearning program. If you want to look at the logistics of this study, you can find it on the hot sheet in front of you, including the participant selection, inclusion, exclusion criteria, experimental and control group, and the outcome measures. The intervention that they decided to go forth with is doing 6 sessions per week between both interventions for 2 hours for each session, and this lasted a total of 3 weeks. The conclusions or outcomes of what they found through this intervention is that both of them showed significant increases through these assessments. Although both of them showed significant increases, CIMT showed a bit better through the FIM score. Something that I think is the biggest takeaway from this, or the clinical bottom line, is that you really need to look at your patient in a holistic view to choose the right intervention for them. This was a small participant selection, and their inclusion criteria had a lot of things that shows that CIMT or the motor relearning program might not be the best for every patient. So you really need to take away from these articles is that you need to be creative with your intervention strategies, and you cannot be cookie cutter in the way that you choose them for each patient, as each patient is going to have a different need and different wants and different abilities in order to move on with therapy. So you really don't want to be a robot as an OT, but you want to continually critically think about the choices that you're making to be have the maximal benefits for your patient. Another takeaway that you can use from this article is that through your occupational profile, you might need to ask additional questions. I know that we have a template that we typically follow, but you need to really listen to the answers that your patient is giving you and maybe ask those additional questions to find out which route you're going to go with your intervention, as every intervention might not be suitable for that individual. So once again, just don't be cookie cutter with the way that you're practicing, and try not to be a robot, but really connect and be holistic with your choices. As we can see from this article, both of these interventions showed significant increases, and Through the 42 individuals, it's unknown as to why that is, but choosing either of them was probably a good thing.